Hello guys. So most of you have just finished your 12th and right now we are entering into MBBS. So this is like a sudden transition, right? From 12th to MBBS, right? So and moreover this video is mainly intended for those who are already studying in MBBS first year and those are about to enter into MBBS. So what is the what is the goal you have to put in your first year? So the goal in first year, most of the students, right, who approach me, they keep on asking me which exam is difficult, which exam is easy, right? So how do I prepare for exams like USMLE? How do I prepare for PLAB? How do I prepare for next exam, right? So one thing I'm going to tell to all of you who are studying right now in MBBS first year is that your goal is not to decide which exam you are going to write. Your goal is not to know about the exams, but the main goal which you have to keep in your MBBS first year is concentrate on basics. So in the MBBS first year, you might be having anatomy, you might be having physiology as well as biochemistry. So your goal should be in concentrating these three subjects like anatomy, physiology and biochemistry. Now when I tell concentrate, what do I mean by that is you have to study these subjects in depth, right? You have to know the depth concepts of these subjects. So anatomy, physiology and biochemistry will form a very good basics for you, and this should be your ultimate goal in your first year of your MBBS. So what do I mean by in-depth concepts is that do not concentrate only on the important topics. You have to concentrate on all the topics which are present in anatomy, physiology as well as biochemistry, because in the real life scenario, the patients who are coming to you are of different categories and different diseases, right? No patient comes to you telling that, doctor, I have a disease from one of the important topic which you study in anatomy or biochemistry or physiology. Any patient can come to you and you must be able to diagnose, you must be able to treat the patient, right? So to do this, you need to have a hardcore concepts. So in the first year, when you come across the first year, anatomy, physiology and biochemistry form a very good basics for your clinical studies. Now, why are you studying anatomy, physiology and biochemistry, guys? At the end, to treat the patient, right? So if you wanted to treat the patient, will you study it as a short answer, long answer, or will you study it clinically? So only when you study these subjects clinically, only then it will be very easy for you to treat a patient. Now, what do I mean by study clinically? Always and always, whatever topic you are studying in anatomy, whether it might be anatomy, physiology or biochemistry, think like a physician, as if the patient is in front of you. So study in that manner so that you can very easily grasp the concept. For example, let us say a MBBS first year student who is studying anatomy, right? I'll also show you how to make notes on physiology and biochemistry as well. But as far as anatomy is concerned, the first subject, an MBBS first year student who is studying anatomy, how he should prepare the topic and how he have to make the notes clinically, right? So for example, all of you can look at this slide over here, right? So I've just taken one topic called as humerus. So this is the anatomy of the humerus. And whenever you are studying clinically, remember one thing, that you need not to know in and out of the topic, right? You exactly have to know what is necessary for you, what is necessary for the exams and what is necessary to diagnose the case. So for example, if you take this topic over here called as humerus, right? So in this, we have just written few parts which are very important, right? For example, anatomical neck, surgical neck, greater tuberosity and lesser tuberosity. Now, this is the normal anatomy. Now, how do I relate this anatomy with the clinical? How do I clinically study this part of the topic? Just look at the next slide. So here, I have written lateral lip, I have written medial lip, right? Lateral lip is having pectoralis major, medial lip is having pectoralis minor. Now, as you can see here, in this slide, let us take, I have taken a topic called as humerus, right? So in this, I have mentioned few parts like greater tuberosity, lesser tuberosity, anatomical and surgical neck, right? So in the next slide also, I've written something like lateral lip, medial lip, pectoralis major is inserted here, in medial lip, teres major is inserted, right? Now, how do I relate all these things which I've studied clinically, right? How do I relate this entire thing clinically is that, see, near the surgical neck, there is a nerve that is passing called axillary nerve. Now, how do I relate it clinically? I relate it clinically like this, that if there is a surgical neck fracture, then which nerve will be injured? So this is what is called as clinical approach. For example, in the posterior side of the humerus, on the back of the humerus, there is a groove called spiral groove. Okay, through that the radial nerve passes. For example, if there is a mid-shaft fracture in the mid part of your humerus bone, the shaft of the humerus, then which nerve will be damaged? The nerve which is passing through the spiral groove, that is a radial nerve. So in the same way, you have got remaining two. In the supracondylar region, you have got some nerves and arteries. In the medial epicondyle, you have got some nerves. I'm not teaching you anatomy right now. I'm just giving you an approach of how to make the notes in anatomy and how to clinically correlate it. So this is how you clinically correlate it. But in the real life scenario, is the patient coming to you with this picture? No. Patient will come to you with an X-ray like this, right? Patient will come to you with a severe pain in the arm. He won't be able to lift the arm, right? So he'll come to you. By looking at it, can you look at the fracture here? No, you need an X-ray. So he'll bring an X-ray to you. And looking at this X-ray, you can find out that this patient is having a fracture in the surgical neck. So clinically, when you studied in your MBBS first year, that surgical neck fracture will lead to axillary nerve injury, right? So by looking at this X-ray, now after becoming a surgeon, it will be very easy for you to diagnose the case and treat the patient. So this is what I mean by clinical approach. So this is what I mean by studying whatever your topic you are studying. All the topics have got clinical correlation. Most of the topics, rather to say. Okay, so don't leave any clinical point from any topic which you are studying. So regarding the resources, guys, what is the best resource which you can use in your first year of your MBBS? For example, let us take a subject called as anatomy. Okay, so in case of anatomy, what are the best resources which you can use? For example, if you wanted to study gross anatomy, right? So for gross anatomy, I would recommend the best resource is Grace. Okay, so Grace Anatomy, and that too the student edition of Grace is the best one. Student edition. Now, this is from my point of view. But still, most of the students, even after telling this, most of the students, and in your medical colleges as well, right? So you study Vishram Singh book, right? You also study BDC, that is BD Chaureshya, right? So it depends upon your wish, whatever book you are studying, but make sure that whatever you are studying, study as per CBME curriculum, which is given by NMC, right? So CBME stands for Competency-Based Medical Education. For example, let me show you the curriculum here. Just look at the curriculum, guys. So this is a Competency-Based Medical Education curriculum, which is given by NMC. Let us take anatomy. So what is the curriculum they have given for anatomy? Just go through this. You can see that regarding, for example, let us start looking at the systems. Yes, right. So in the upper limb. So in the upper limb, so what are these 1, 2, 3? You see 1, 2, 3 here. What are these 1, 2, 3? These 1, 2, 3s are nothing but competencies, right? You have to fulfill these competencies. For example, you can see here, enumerate the peculiarities of clavicle, right? So previously, the curriculum used to be like this. There used to be short answer questions, long answer questions and all. But right now, the curriculum is completely changed. So there are a lot of competencies here. For example, if you look at another topic, for example, pectoral region. Within the pectoral region, you have got 3 competencies, right? So what is this competency is that the NMC wants to know whether a medical student is competent enough to diagnose the case, competent enough to understand the case, and finally treat the case. So all these competencies are not short answers or long answers. These competencies are completely clinical competencies, right? So if you can see here, in the pectoral region, you see the attachment nerve supply, right? And the actions of pectoralis major and minor. So what will happen when the nerve is damaged? What will happen when the pectoralis major muscle is paralyzed? So this is how you need to study. Okay, and coming to the next competency, the breast. Breast is the most important topic, not only in anatomy. If you are perfect with the breast in anatomy, that will help you in pathology as well as in surgery also. So you need not to study that time again. In the same way, the example which I have just shown you, right? For example, this is the humerus and the fractures and all of these surgical neck, mid-shaft fractures, whatever things I've shown you. These are the topics which you discuss in orthopedics. So once if you are perfect in anatomy, whenever you're studying anatomy, if you study all these topics clinically, and once when you start studying the orthopedics, it would be very easy for you. You need not to study that time in orthopedics all these things. Okay, so this is how the clinical approach helps you in a lot of ways. Okay, so whatever textbook you are studying, guys, that doesn't matter, but remember one thing: study as per CBME curriculum which I have shown you. So whether whatever topic you are studying, whether you are fulfilling all those competencies in that topic or not, just go through that, right? So the students who are studying in India, right, so the professors in their medical college, they teach as per their curriculum only. But students who are studying in abroad, right, so each country has got a different curriculum. So for all the students, all the Indian students who are studying in abroad, I am going to tell you one thing, that whatever topic, whatever you are studying, check whether you have fulfilled those competencies or not. Okay, so regarding the gross Gray's Anatomy student edition is the good one, right? It is an updated one. And second important thing is that if you wanted to study neuroanatomy, right, for neuroanatomy, I would personally suggest Crossman's neuroanatomy book, right? So the images in Crossman's are perfect and very clear, and the language, whatever you study, right, the language is so feasible to understand, right? So this is simple like a layman language which you can study. So Crossman book is a perfect book for you for neuroanatomy. Okay, so the Crossman's is a very good book. So Crossman neuroanatomy is a very good book, right? Now when it comes to embryology, the book which I would recommend is, obviously most of you might be using Inderbir Singh, right? So IB Singh is really a good book. And apart from that, I would also request you to use Langman, right? So Langman, the pictures in the Langman are so crystal clear that you can very easily understand the embryology. So even I studied my embryology during my time from Langman only, and neuro from Crossman, and the student edition of the Gray. So these were really the good books which helped me to ace in anatomy. Now when it comes to histology, what I did is that I did not use any book. You know, histology is all about blue and pink study, right? So personally telling you, I mean, obviously there are books, if you wanted to use, you can use it, but I personally never used any book. What I concentrated in histology is, I mainly concentrated on the slides, because this is the only thing which they are going to ask you, right? Once if you become a clinician, once if you become a doctor, right, you are not going to write a essay question or a short answer question on different histological slides, yes or no? What is the ultimate thing you are going to do if you learn histology? You are going to identify a slide, and based upon the slide, you are going to tell what kind of ulcer is it, what kind of disease the patient is having, right? So what I concentrated on that ultimate end point. What is the ultimate end point? Identifying a slide is the ultimate end point. So what I did is that from day one of my histology class, I studied only and only slides. Now in the slides also, I learned how to identify cells, right? How to identify layers, how to identify epithelium. What kind of epithelium is this? Whether it is squamous epithelium, whether it is cuboidal epithelium, whether it is columnar epithelium. So you need to identify these epitheliums. Why? Because if you get a slide where a particular epithelium is eroded, then you will tell it that this is an ulcer. You will tell it that so and so epithelium is damaged, right? So how to identify a epithelium, learn how to identify a epithelium, right? And next important thing is that learn how to identify a granuloma or a tumor. So these are some of the basic things which I studied in my histology, right? For example, I'll just give you one example, okay? Just look at this slide which I have kept it here. Now this is a slide of a normal colonic wall, okay? You can see many projections inward and outward, yes or no, right? Now just compare this slide with this slide now. Now what is the difference in both of the slides? Let me minimize the screen. What is the difference in between both of the slides? The first one is absolutely normal, but look at the second one here. right? See, from here till here it is normal, from here till here it is normal, and in between here, can you see an ulcer over here, guys? Can you appreciate an ulcer? So this is an ulcer. And how is this ulcer looking? This is looking like a flask shape, right? So such kind of ulcers are called as flask shaped ulcers, which you see in entamoeba histolytica. So directly if you go through the flask shaped ulcer, it will be very difficult for you to understand. Once if you know the normal slide and then look at an abnormal slide underlying it, right, then it will be really easy, and believe me that you won't forget such kind of slides. Okay, so entire histology I did the same way, studying the normal and clinically correlating it, studying the normal lining of an intestine, clinically correlating it, studying the normal thyroid gland, clinically correlating it, studying the normal breast tissue, clinically correlating it with the breast cancer. So this is how I studied histology, and I want all of you to study the same way itself. Okay, right guys, so this is all for anatomy. And when it comes to physiology, physiology is a world of mechanisms, guys. I'm telling you, the better in the first year, the more interestingly, the more love you show towards physiology, that is going to help you for the rest of your MBBS. Because all the concepts which you study in medicine, right, in pathology, in pharmacology, whatever subject you take, physiology is definitely more than 50% that is included in those subjects. So physiology is all about mechanisms. I want, even if it is taking a lot of time, see, once upon a time I studied neuromuscular junction for about 3 to 4 hours. Physiology is a world of mechanisms, guys. So I'm telling you, study all the mechanisms in physiology and show at most love towards this subject, because once if you are perfect with all the mechanisms, many subjects in MBBS are based on physiology only. For example, in medicine, in pathology, pharmacology, most of the subjects, in every subject, more than 50% of the concepts are based on physiology only, right? So even if it is taking a lot of time, see, once upon a time when I studied juxtaglomerular operators and neuromuscular junction, yeah, in neuromuscular junction topic, I took around 3 to 4 hours. But you can complete the topic in 10 to 20 minutes now, because a lot of sources, a lot of videos are there. So in those days, there were no videos and all. So all we have to study is from the textbooks. So till today, I remember that neuromuscular junction topic very clearly, guys. So that's what I'm telling you. Study all the concepts in physiology. I'm telling you, physiology is really, really, really interesting. So the best resource I would suggest you, the gold standard resource, rather to tell, the gold standard resource in physiology I would suggest you is Genong Physiology. Genong Physiology. Now when I tell physiology, I know most of you have thought that I would tell Guyton Physiology, but remember one thing, Guyton is mainly studied by MD physiologists, right? And moreover, Guyton is an experimental physiology. Now when I tell by experimental physiology, for example, if you are studying Guyton, if you are stuck at one topic, right, you will be stuck at that topic for days, for hours and for days, right? So that is a waste of time. Your preparation for physiology, the momentum in which you are preparing for physiology will be reduced. So when you choose books like Genong, the momentum will be increased and you can very easily understand. And again, I'm telling you, in Genong Physiology, the text, whatever is there, right, the way he is explaining is a complete layman language. Very easily you can understand. There is no high level English there, high level English used there. It is completely easy English which is used there, right? And next important thing is that any physiology book you take, from one book to another book, the values will differ. Physiology is all about values, right? What is the normal value of potassium, normal value of serum sodium, right? Normal value of glucose. So they differ from one book to another book, but in Genong Physiology, the values are standardized. So you can trust on these values. So you will have standardized values on this. Standardized values. And again I'm telling it is of your choice, right? Whatever book you want, you can use, but this is completely the approach which I'm giving you based upon what most of the doctors did. Most of the doctors use these as a research. Repeat. But still again I'm telling you that it depends upon you what resources you use, but these resources which I've told you are gold standard, and most of the doctors use these resources. Even during my MBBS I studied from these resources only. Regarding biochemistry, right, regarding biochemistry, most of the students really find difficult in studying biochemistry. Now when I tell biochemistry, guys, right, when I tell biochemistry, right, just to use a fancy term, right, most of them so when I tell biochemistry, just to use as a fancy term, most of them tell directly Harper, right? A first year medical student studying Harper is very, very difficult, right? So don't use this textbook Harper in your first year of your medical school, I'm telling. So biochemistry is all about understanding the pathways. Now I'll tell you exactly how to prepare biochemistry. I want you to prepare exactly the same way, right? No patient tomorrow will come to you, ask, doctor, how many ATP I'm generating in my body, how many NADP I'm generating in my body, how many protons I lost, right? All he is coming to you with a problem only, right? It is your duty to identify what kind of problem he might be having. Is he having any kind of anatomical problem? Is he having any kind of deficiency in his body? Is he having any mutation in his enzyme? So these are the things that you as a doctor have, and you can only do only when you understand the subject from the roots. Okay, and remember one thing, the first thing I told you is, why are you studying anatomy, physiology and biochemistry? To treat a patient, right? So when you are treating a patient, you need not to cram the pathways. Yes or no? You need not to cram. What is the point of cramming the pathway? You have to understand the pathways which are located in this biochemistry. For example, you come across many pathways, right? For example, let us say glycolysis is one pathway, okay? TCA cycle is one pathway, right? HMP pathway, right? And also PDH complex. There are much more pathways here, but I've given you few examples. Now when you are studying these pathways, never ever cram these pathways, guys. What all you need to study here, right? You need not to study everything in the pathway. What you need to study here is that you need to study where these pathways are occurring. See, whatever point I'm telling you, I'll tell it clinically only. You have to know where are these pathways occurring. For example, let us say you know a cycle called as gluconeogenesis, right? Gluconeogenesis does not occur in the muscle, it occurs in the cortex of the kidney as well as the liver. Then why gluconeogenesis is not occurring in the muscle? It is also our body tissue only. The only reason is, in gluconeogenesis we need an enzyme called glucose 6 phosphatase, and that enzyme is located in the kidneys as well as the liver, but it is absent in muscle. That is why gluconeogenesis will not happen there. So this is the point which something clinically correlates with this topic, right? So you have to know which organ the cycle takes place, in which organ or the tissue the cycle takes place. This is one important thing you have to know. Second important thing when you're studying biochemistry you have to know is that, especially these cycles, what are the rate limiting steps? RLE, rate limiting steps. Now what do I mean by rate limiting steps is that, in the entire pathway of glycolysis, let us say glycolysis, in the entire pathway of glycolysis, the slowest step in the pathway is called as a rate limiting. And usually this step is not reversible, it is irreversible. For example, let us take an example. For example, right, if you look at this path, for example, if you look at this pathway, right, this is the glycolysis pathway. So in the glycolysis, glucose converting to glucose 6 phosphate, then further converting to glucose 6 fructose 6 phosphate, and then fructose 1,6 bisphosphate, right? Now here you can see a unidirectional reaction, right? For example, you can see a single direction reaction here, you can see a single direction reaction here. Now these steps are called as rate limiting steps, and these enzymes are called as rate limiting enzymes, right? So these are irreversible. So you have to remember these steps at any cost, because these are the steps that are asked in the exams. Okay, so this is the second important thing. And third important you need to know, apart from these reactions and all, is the enzyme deficiency disorders. enzyme deficiency disorders. So enzyme deficiency disorders play a very important role. For example, guys, now when I tell enzyme deficiency disorders, just knowing that this deficiency causes this disease is not enough. You should again, I'm telling you, you should again clinically correlate this subject. Yes, even biochemistry is also, you can clinically correlate this subject very nicely. So just look at this, repeat. Now, when I tell enzyme deficiency disorders, it doesn't mean that just knowing the name of the enzyme, if it is deficient, what disease will it happen. So, knowing that is not just enough for you. Repeat. So, when I tell enzyme deficiency disorders, just knowing the deficiency of an enzyme and knowing what disease it causes is not enough. You should even know what is the symptoms of the patient. You should also know what are the symptoms of the patient, right? Just look at the example which I am telling. For example, here, you know, lactose converts into glucose and galactose. And galactose further it is metabolized into galactose 1-phosphate. Galactose 1-phosphate joins with another molecule here called as UDP glucose. They interreact and form glucose 1-phosphatase and UDP galactose. Now this is a normal way of studying biochemistry, right? Just to pass your exams. Now if you wanted to clinically correlate it, how do you clinically correlate it? You have to know what are the enzymes that are located in these steps. What will happen if this enzyme is deficient? For example, let me tell you this thing. For example, if lactase is deficient, do you think lactose will be converted? Lactose will not be converted. So when lactose will not be converted, the condition which I got here is called as lactose intolerance, right? In the second case scenario, look here, if galactokinase is deficient, do you think galactose will be converted to galactose 1-phosphate? No. Then what will happen? The levels of galactose keep on increasing, right? And once the levels of galactose keep on increasing, galactose will be converted into another molecule called galactitol. Galactitol, right? And what will happen to this galactitol? This starts depositing in your eyes, leading to cataract. You see? Now, will the patient come to you telling that, doctor, I have galactokinase deficiency. I'm afraid that I will have cataract. Will he come to you with their complaints? No. So how the patient is going to come to you is, doctor, I have cataract, right? Now it is your duty to diagnose if there is enzyme deficiency cataract, or cataract might be because of some infection, or cataract might be because the patient is having diabetes. So it is your duty to diagnose that. You will only diagnose again when you clinically understand all the subjects, when you study all the subjects with clinical correlation, right? And this condition which I have explained you is called as galactosemia. And final important thing in biochemistry you need to know is, the fourth important thing is, vitamin deficiency is very, very, very important. So whenever you are studying biochemistry, guys, make sure that you concentrate on all this. Cycles are very important, enzyme deficiency disorders are very important, vitamin deficiencies are very important, right? So build up your clinical knowledge, and not only that, even for you to get a good score in the exams. So regarding biochemistry, these things are very, very, very important. Okay, so this is how I want all of you to study, guys. I hope right now you might have understood after watching this video how to study each and every topic, how to make the notes, right? Don't you make unnecessary notes. And always remember, even if you in anatomy, even if you are using BDC or Vishram Singh, don't study the entire thing, because it is highly impossible. If you want, you can ask your seniors also who are studying in second, third, fourth year, final year, who are about to graduate. Ask them whether they remember everything they studied in BD Chaurisha. No, right? So it is highly impossible to study each and every point in anatomy, each and every point in physiology, each and every point in biochemistry. But it is definitely possible that whatever topic you are studying, to clinically correlate it and remember it in your brain, right? So that is definitely possible. And remember one thing, whenever you are making a note, right, whenever you are making notes, I want you to make with pictures, because there is a famous saying called as, a single picture speaks 1,000 words, right? So when you make a picture and study, you are actually saving a lot of your memory, right, instead of studying a paragraph. So always and always try to make up a picture. If it is biochemistry, try to make up a schematic presentation, schematic diagrams, and then study the subjects, right? And The most important thing is that, guys, studying is very easy. Gathering information is also very easy, but the difficult part is revising, right? So I want all of you to revise and recite. Revision is very, very, very important, and only when you can revise. And when can you revise effectively? You can revise effectively only when you make beautiful notes, right? Beautiful notes in the sense, I'm not telling you to make flowers on the side of the topic, you know, make it colorful and waste time there. No, what I'm telling you is making the notes in the sense, writing down, putting down the things only which are very important to you and which are very important for you when you become a clinician, right? So this is how your preparation strategy has to be. And final thing I'm going to tell you is that when the first final thing I'm going to tell you is that keep in mind one thing, that hard work is definitely needed, right? So the entire medical field, so you might think you got a seat in your MBBS, now it's time to relax. No, this is the actual phase to start working hard, right? So you have to work hard like you never did before, I'm telling you. So hard work is very, very crucial and very, very important. The more harder you work, the more important things you're gonna grasp, I'm telling you. It doesn't depend on how many hours you worked hard in your MBBS, guys. It all depends upon how much information you collected, right? What is the standard information you have collected from the books is very important, right? So writing down all the useless information is not needed, even if you are sitting for 8 hours, 9 hours at a stretch, right? So even if you're sitting for 1-2 hours and collecting very important and standardized information, so that plays a very important role in your MBBS. So this is all I wanted to discuss regarding the first year MBBS students on what are the resources they basically use. These are some of the resources and how do they make the notes, right? So I hope this video will definitely help you, and if you really like this, I will also make a video on how to study the subjects in second and the further years, right? So goodbye, take care, and my best wishes.